Question number 86, that there is a regarding the uterine artery, which is which of the following is statement is false. But before the options, let us just have few important things to know regarding the uterine arteries. That the uterine arteries, they arises from the anterior branch of the internal iliac artery, we know that, and it comes crosses the ureter anteriorly, like they comes anteriorly to the ureter, and it is the primary source of the arterial supply to the uterus and its branches, anastomosis with the branches of ovarian and vaginal artery, we know that. So let's move towards the option number one is, they usually arises from the anterior branch of the internal iliac artery. Yes, that is true, and it crosses the ureter posteriorly. No, they crosses the ureter anteriorly, so the option B is false. It is a primary vessel responsible for the arterial blood supply for the uterus. Yes, it is a major branch of the uterus, and then typically anastomosis with the branches of ovarian artery. Yes, it also anastomosis with the vaginal arteries, and it travels through the broad ligament of the uterus. Yeah, no, it does not. Does it? Yes, it too travels through the broad ligament of the uterus. Yes, that is correct. Okay, I also get confused a lot of the time between the broad ligament and the round ligament, and I know that you people also get confused, so that's why I stopped here. So it is it is true that they travels through the broad ligament of the uterus. Now the next question number 87, and regarding the lymph drainage of the breast, where does the majority of the lymph drains to? We all know that the answer is the axillary nodes. So the option B is also two answers. And the majority of the lymph nodes, such as the 75% of the lymph drainage, it occurs by the unilateral axillary nodes, right to the right and left to the right. The majority of the remainder is drained by the parasternal nodes. Yes, there also comes the some nodes present in the near the sternal areas. These are the parasternal nodes, and they also drains the breast. Question number 88, the round ligament, it leaves the pelvis by what? It does leave the pelvis in through the deep inguinal ring, and the round ligament of the uterus, it originates at the uterine horns, where the fallopian tubes, they attach to the uterus, and the round ligament, they leaves the pelvis by the deep inguinal ring, passing through the inguinal canal, and continues before the fibers they attach to the mons pubis. Question number 89, a patient, they attends a clinic with the vaginal prolapse. On examination, the vagina, they protrudes 1.5 centimeter below the plane of the hymen according to the POP-Q classification. What is its grades of the prolapse? We know that it is the hymen which plays the important role in the case of the POP-Q classification, and we know that when the prolapse is more than 1 centimeter below the plane of the vagina, then it is the grade 3. It is the grade 3 when it is up to the 2 centimeter. Then when it is more than 2 centimeter, it is grade 4. So the answer is the grade 3. It is the grade 3 vaginal prolapse. I think this is not the grade 4. It is grade 3. Question number 90, the internal and external inner sphincters, they both receive innervation from which spinal segment? We have discussed it previously that it is S4. The inner sphincter, again, which is divided into internal inner sphincter and external inner sphincter. We have discussed that the internal inner sphincter is involuntary, sympathetic contraction is contractions, parasympathetic is relaxation, and innervation is by the pelvis flanking nerve, which is the S4. Similarly, the external inner sphincter, they are the voluntary, and the innervation is by the inferior rectal branch of the pudendal nerve and the perineal branch of the S4. Question number 91, regarding the lymph drainage of the fallopian tubes, where does the majority of the lymph drains to? Yes, the fallopian tubes, like their ovaries, they are going to drain to the para-aortic lymph nodes. And next question, the broad ligament, they contain which of the following structures? Yes, the broad ligament, it does contain the uterine artery. We have discussed this MCQs previously. Along with the uterine artery, it does have the fallopian tubes, the ovarian artery, the uterine artery, ovarian ligaments, and round ligament of the uterus. It has got the fallopian tubes, the ovarian arteries, the uterine arteries, ovarian ligament, and round ligament. So it is FOUR. If you go off 4, it has the fallopian tubes. This is the mnemonic. It has a fallopian tubes. It has ovarian artery and ovarian ligament. It has got the uterine arteries and the round ligament of the uterus. Next question, the posterior scrotal artery is a branch of the which artery? The posterior scrotal artery, it is a branch of the, it is the branch of the hair. I think the options are wrong. It is the branch of the perineal artery. It is a branch of the perineal artery. The options are different from the question. It's a branch of the perineal artery. Here you see there is a posterior scrotal artery, which is a branch coming from the perineal artery. And question number 94, the normal functional bladder capacity of a healthy human urinary bladder is approximately 500 ml, and the range is between the 400 to 600 ml. And first urge to void is typically felt when the bladder is up to 150 ml filled. Next question, you have been asked to perform a pudendal nerve block on a patient by your consultant. The pudendal nerve is formed from which spinal segments? We all know that they are formed from the S3, S2, S3 and S4. So option D is the correct. And it provides the sensations to the clitoris, the labia majora, and along with the both labias, along with the ilioinguinal nerve. Question number 96, the rectus sheath is formed by which of the following? The rectus sheath is formed from the aponeurosis of the transverse abdominis, external and internal oblique. The rectus sheath is formed by the aponeurosis of the transversus abdominis in the external oblique and the internal oblique muscles, and it contains the rectus abdominis and pyramidalis muscles as well, and it is one of the important SPs. Next question, the ascending colon, they drains into the superior mesenteric vein. What does the superior mesenteric vein drains into? Yes, they drain into the hepatic portal vein. Drains into hepatic portal vein. This is the superior mesenteric vein. It joins. This is the superior mesenteric vein. Oh, here you goes that this is the superior mesenteric vein. This is the superior mesenteric vein along with the splanchnic vein. They are going to form the hepatic portal vein. The superior, sorry, this is the splanchnic vein, not the inferior mesenteric vein. This is the superior mesenteric vein along with the splanchnic vein. They are going to form into the hepatic. Now let's move toward the question number 98. A patient, they undergoes a surgery for a vaginal wall prolapse, and after surgery she complains of the numbness and the groin pain, and you assess her and find the numb area in the anterior aspects of the labia. Which nerve they likely to be damaged during the surgery? It is the ilioinguinal nerve, which is likely to be the damage, because it has a very potential, it is very common and potential complication in the pelvic surgery that the sensory area this sensory area is supplied by the ilioinguinal nerve. Question number 99, and look at the diagram of the fetal skull below, and what is the part of the labial label at the A. This is the anterior of the head, and this is the posterior of the head. So this the A is the occiput of the fetal skull, occipital bone of the fetal skull. And we have in the previous sensor we have discussed that this is the lamboid suture, and this is the sagittal suture, and this is the anterior fontanelle, and these are the frontal bones. And let's move towards the next question, and that is question number 100. In the male urethra, what type of the epithelium would you like to expect to find close to the external urethral orifice? We have discussed that the transitional epithelium is in the proximal part of the urethra, and it is the stratified squamous epithelium which is present in the rest of the urethra. And at the proximal end of the urethra, where there is a prostatic urethra, there is transitional cells epithelium which is are the continuations of the bladder and the ureter. The epithelium then changes to the stratified columnar, and then to the stratified squamous. What is stratified columnar? And then to the stratified squamous near the urethral orifice. And here we see if this is the bladder, this is the urethra, and the bladder has a transitional epithelium, and then the urethra, proximal urethra has again the transitional epithelium. Then the it is changed into the stratified columnar, and then to the stratified squamous near the orifice. Squamous. So the answer is correct answer is stratified squamous. Regarding the uterine artery, which of the following is true? The uterine artery, we know that it arises from the internal iliac arteries, and particularly the anterior division of the internal iliac artery, and vaginal artery, they typically arises from the internal iliac artery as well. So let's see the options. That it arises from the external iliac artery, no. It arises from the internal iliac artery, yes. And it arises from the vaginal artery, no. It arises from the vaginal artery, no. It arises from the internal pudendal artery, no. Next question. Which two nerve they provide the primary cutaneous sensory innervation to the labia majora? The labia majora, they have asked regarding the sensory innervation. The pudendal, it provides the cutaneous innervation to the posterior external genitalia by one of the terminal branch called the perineal nerve, and this further divided into the posterior labial nerve or the posterior scrotal nerve in the man. The ilioinguinal nerve, they provides the anterior sensation why the anterior sensation why the anterior labial nerve or the anterior scrotal nerve in the man. And the genital branch of the genitofemoral nerve, they contribute some fibers to the skin of the mons pubis and the labia majora in the female. The posterior cutaneous nerve of the thigh, they sometimes overlap the sensory sensory areas. So there will be the ilioinguinal nerve, and as well as the pudendal, the ilioinguinal nerve and the pudendal. So the option is B is the correct. These are the different options. So here this is a diagrammatic view, that this is the anterior part of the genitalia is supplied by the ilioinguinal nerve, and which is also come together with the genital branch of the genitofemoral nerve, and then the posterior perineum is supplied by the pudendal nerve, and the posterior cutaneous nerve of the thigh. Next question. The bladder neck closure and the relaxation of the bladder is mediated by we know that it is the sympathetic fibers of the L1 and L2, and sympathetic is the storage, and parasympathetic is peeing, like P for parasympathetic, P for peeing, and sympathetic, S for sympathetic, S for storage. Okay, the lumbar plexus is derived from which spinal segment? It is supplied by the T12 to L4. The lumbar plexus, they give rise to a number of the important nerves that traverse the abdomen and the pelvic cavity. It is formed by the contribution from the spinal nerves T12 to L4. T12 to L4. This is T12, 1, 2, 3, and 4. T12 to L4. And these are the nerves. Number one is the iliohypogastric nerve. This comes from T12 to L1. This is the iliohypogastric, and they are going to innervate the muscles. These are the transversus abdominis, internal oblique, and the sensory branches of give rise to the sensory branches of the upper buttock and the skin of the mons pubis. The ilioinguinal nerve, they rises from the L1. This is the ilioinguinal. This is the ilioinguinal nerve, and then the genitofemoral nerve, it arises from this is genitofemoral nerve, and it arises from the L1 and L2, and it is going to innervate the cremaster in males, and it is also going, the sensory branches, they give branches to femoral branch will supply to upper proximal thigh, and genital branch will supply to small area of the scrotum, and then the lateral femoral cutaneous nerve, these are the L2 to L3, and they are the sensory branches, and they supply the lateral femoral cutaneous branches. Now the next is the obturator nerve. It arises from the L2 to L4 segments, and it is going to innervate the obturator externus, obturator longus, Adductor brevis, the gracilis, the pectineus, and the adductor magnus, and the sensory branch is to the cutaneous branch, which is the supplies to the medial thigh. Then the femoral nerve, which is from L2 to L4, and it is going to supply the ilios vas, the pectineus, the sartorius, and quadriceps femoris, and the sensory supplies anterior cutaneous branch, which is going to supply the anterior thigh, and the saphenous sensory branch, which is going to supply the medial lower leg. Now, question number 105, looking at the diagram, the coronal structure is represented which label, the coronal structure. So, what is the coronal structure? This is the coronal structure, and this is a sagittal suture, this is a lambdoid suture, and the lambdoid and sagittal are going to make the posterior fontanelle, and the coronal suture and the sagittal suture, they are going to form the uh, anterior fontanelle. Okay, and which of the following is a branch of the pudendal nerve? The pudendal nerve is the perennial branches, they arises from the pudendal nerve, and the pudendal arises from the S2, S3, and S4, and its terminal branches includes the inferior rectal nerve, the perennial nerve, and the dorsal nerve of the clitoris, and the muscles innervated by the pudendal nerve. They are the bulbospongiosis, ischio-cavernous muscles, the levator and eye muscles group, and external anal sphincters, and the female external urethral sphincter. Question number 107. The descending colon, they drains into the inferior mesenteric vein. The descending colon, it is drained in inferior mesenteric vein. What vein does the inferior mesenteric vein drains to? The inferior mesenteric drains. This is the inferior. We have discussed in the previous diagram. We have discussed the superior mesenteric vein. Now this is the inferior mesenteric vein, and here, if you see in the diagram that this is the inferior mesenteric vein, this is the inferior mesenteric vein, and it is going to be drained into the splanchnic vein. This is the splanchnic vein. It is going to drain into the splanchnic vein. In the previous SP, we have discussed that this is a superior mesenteric vein. Along with the splanchnic vein, it is going to form the hepatic portal vein. In here, there is this inferior splanchnic vein. It is going to drain. This is the inferior splanchnic vein, and it is inferior mesenteric vein, which is going to drain into the splanchnic vein. So the answer will be the splanchnic vein. This is not correct. Question number 108, regarding the rectus sheath, which of the following the statement are the true? Regarding the rectus sheath, the rectus sheath it is important to appreciate the rectus sheath changes, and which are below and above the arcuate line. The arcuate line, it occurs about the 1/3 of the distal from the umbilicus, distance from the umbilicus. If this is the abdomen, and this is the umbilicus, then the arcuate line, it occurs about 1 to 3 of the distance from the umbilicus to the pubis. If this is the pubis crest, then this is it is about 1/3 of the distance. Here this will be the arcuate line. This is the arcuate line, and if you look closer, then you will see that the rectus abdominis is in the top, is enclosed with the internal oblique and the transverse behind. In contrast, in the lower where there is the representing the arcuate line, all the epinosis, they are anterior to the rectus. All the epinosis are anterior to the rectus. Let's move to the option that regarding the rectus sheath, which is important. Above the arcuate line, internal oblique divides into two laminae. Yes, this is the true that above the arcuate line, above this arcuate line, the internal oblique, it divides into two end lamina, which are the anterior and the posterior. Below the arcuate line, the internal oblique there divides, no, it occurs above, and below the arcuate line, the external oblique muscles, they divide into two laminae, no. Above the arcuate line, the external oblique divides into two laminae, no. Below the arcuate line, the transverse divides into two incumbus, no. Now let's see the question number 109. The average functioning adult kidney contains how many nephrons? It is between 8 lakh to 1.5 million nephrons in each adult kidney. So it was not mentioned in the options, but It is between the 8 lakh and 1.5 million, almost 1 to 1.5 million. Okay. Now question number 110. The ureter, they receive autonomic supply from which spinal segments? It is from the T11 to L2. The ureters, they receive the innervations by the number of the nerve plexus. The nerves, they supplies the ureters originally from the spinal segments of T11 to L2. When you think about the ureteric colic give classic loin to grind pain, it is because the pain is referred to these dermatomes. These are the T11 to T11 T11 to L2. This is the loin to groin, T11 to L2, loin to groin pain. Question number 111 regarding the levator and eye, which of the following statement is true? Again, when the come option true, we'll first see the little explanation about the levator and eye muscles. The levator and eye muscle is innervated by the pudendal nerve, the perineal nerve, and the inferior rectal nerve. These nerves, they arises from S3, S4 spinal nerves, mainly S4. In some people, the spinal nerves innervates the muscles directly. Levator and eye, they get its arterial supply from the inferior gluteal artery. Let's move towards the answers. Options: innervation is derived from the L5 to S1. No. We have discussed that innervation is derived from the S3, S4 spinal nerves. So option A, B are incorrect, and it is supplied by the superior rectal artery. No, it is supplied by inferior gluteal artery, inferior gluteal artery. So again it is supplied by superior rectal nerve is wrong. Okay. And now question number 112. The plane of the pelvic inlet is at what angle to the horizontal? And we all know that this angle is basically the 60-degree, and the option D is correct. And question 113. In the female, the pudendal nerve branches, they are the branches of the pudendal nerve. They are we know that it is the perineal, inferior rectal, and dorsal nerve of the clitoris. Okay. And question number 114. A baby with those shoulder dystocia suffers a brachial plexus, and the mother, they ask you if it will be permanent. What percentage of the babies, they will be permanent neurological dysfunction as a result of the brachial plexus injury secondary to shoulder dystocia? It is less than 10%. So it is good news that many shoulder dystocia babies, they most of them, they get this palsy. But the good news is that it is the less than 10% of the chances that it get permanent. According to Green Top Guidelines 42, shoulder dystocia occurs in about 0.65% of the deliveries, and the brachial plexus injury occurs in 2.3 to 16% of the shoulder dystocia, which is too big. And in more than 90% of the cases, there is no permanent neurological disability. So this is the good news. Shoulder dystocia is the most common cause of the Erb's palsy, Duchenne palsy, where there is the injury to the C5 to C6 of the brachial plexus. Otherwise, the brachial plexus are from the C5 to T1. Lymph drainage of the bladder is via which lymph nodes? These are the external, internal, and common iliac nodes. Option A is correct. Question number 116. A patient, they undergoes the oophorectomy and ovarian veins are ligated. Which veins does the left ovarian vein drains to? The left ovarian vein, it drains to the left renal, and the right ovarian vein, it travels through the suspensory ligaments of the ovary and generally joins the inferior vena cava, where the left vein, they drains into the left renal vein. Which of the following muscle, they does not receive the innervation from the pudendal nerve? It is the internal anal sphincter. The rest, external anal sphincter, external urethral sphincter, bulbospongiosus, and levator and eye, they do get the innervation from the pudendal nerve. Now, which ligaments, they attach the vagina and the cervix to the pelvis? These are the carnal and the urosacral ligament. The broad ligament, they attach the uterus to the pelvic wall, and the carnal and the uterosacral ligaments, they are the key attachment for the vagina and the cervix, and they are sometimes considered a single complex and also aid the stabilization of the uterus. Question number 119. You are reviewing a patient which is complaining of the pain and numbness of the proximal medial thigh following the abdominal hysterectomy. You suspect the genitofemoral nerve injury. What spinal segments is the genitofemoral the nerves it drives from? It is L1 and L2. We have discussed it previously, and this is again the revision of these nerves, and they are very important. Question 120. Which of the following muscle is not a constituent of the pelvic floor or the diaphragm? It is the piriformis, because the pelvic floor or the diaphragm, it is composed of the coccygeus, levator ani. Levator ani is composed of the three muscles, which is the puborectalis, pubococcygeus, and the iliococcygeal. Although the piriformis they assist in the closing the posterior pelvic outlet, it is not considered as a compartment of the pelvic floor. Next, what is the average oblique diameter of the pelvic inlet according to RCUG? It is 12 centimeter. The dimensions: anterior posterior, the sacrum to pubic symphysis, it is 11 centimeter. Oblique, it is from the sacroiliac joint to the iliopectineal eminences, is 12, and transverse, the widest points on the iliopectineal lines are the 13 centimeter. Question 122. You are reviewing a patient who is complaining of the pain and numbness of the right anterior aspects of the labia, and following abdominal hysterectomy, you suspect the ilioinguinal nerve injury. What spinal nerves? We know that the answer is L1. L1. Ilioinguinal nerve injury is one of the most common injuries associated with the pelvic surgery. Question 123. What is the anatomical landmark used for the gauging the station of the fetal head during the labor? It is the ischial spines. The ischial spines is the anatomical landmark for the assessment of the stations of the fetal head, and also placing the pudendal nerve block. And the ischial spines, they can be palpated approximately 8 cm into the vagina at 4 o'clock and 8 o'clock position. 124. What is the average anterior posterior diameter of the female pelvic outlet? It is 13 cm. We have discussed it previously. And question 125. Sterilized cells, it contains receptors of which hormone? These are the inhibin, it is the FSH hormone. We know that L for Leydig and L for LH, and the other is the Sutherland FSH. Question 126. In the male urethra, where do the ducts of the... And here this concludes our session, and we are going to discuss further MCQs in our next videos. If you like the video, kindly share the video and subscribe the channel. Till then, take care. Bye bye.